welcome to our channel, Dr. Shreyas. First of all, thank you so much for taking your time out and coming and joining us and probably giving us some insights into what pediatrics is all about. So we'll start from the very beginning. How and why did you choose medicine?
The first and the foremost thing, thank you for inviting me here. And you guys are making a very nice podcasts, and by inviting the right people and selecting the right topics and making it easier for the public to understand the right things which they are in need of.
Thank you.
So for your first question, I think I was interested in medicine from my childhood.
Okay.
The thing is, what I used to see in doctors is they make a difference in the public by treating the diseases. That was my mindset. To cure is the thing in medicine. So I was very much interested from my childhood, and I always wanted to become an ophthalmologist.
Okay.
But then later, when I got to know that I have very short-sightedness and couldn't do the surgical skills, so I just neglected all the surgical side of the branches and I concentrated more on medicine and pediatrics.
Okay.
And then of course I love kids more. And there are many doctors who have influenced me to take up pediatrics.
Okay.
So I ended up in pediatrics like that.
Okay. So do you come from a family of doctors or with a background of medicine in your family?
My dad's side there are many doctors,
Okay.
and mom's side maybe I'm the first.
Lovely. Okay. So can you tell us a little about how your medical school has been and how your journey has been until you started practicing?
I completed my PUC in Mangalore, expert. Then after that I really wanted to join medicine only. So, and I couldn't get, being in general category and everything, I couldn't get in the first thing. I was always an average student, not so genius and all. So I had to drop one more year, study for medicine, and then get through JSS Medical College. I got in the second attempt. So I joined there in Mysore. I had my aunt, so I stayed with them in their home and completed my medicine there in Mysore.
Okay.
And of course I enjoyed the UG life there. And I always keep telling that JSS Medical College itself, the Mysore itself is royal. So I have done my UG days in a royal manner. So, and enjoy doing medicine there.
Lovely. As passionate as you sound, so it's really nice. Although you honestly say that you're an average student, I'm sure you're doing wonders where you're doing. I'll get into your specific area, right? So pediatrics is all about cute babies for a lot of people, right? How challenging is this space?
Actually, it's very challenging because being adults, we know what are we facing, what are our difficulties, what are the problems, what are the diseases we have. Even if we have cold, cough or anything, any problem we have that ability to tell others.
Absolutely.
So when we go to a doctor also as an adults, we know what to tell them, that these are our problems. Kids, it is not the thing.
True.
They don't know. It's we as doctors or pediatricians, we have to rely on the history given by the parents, basically. So based on that, most of it what we give is the symptomatic treatment at that time. And then on behalf of that, we'll have to do some investigations and then go about it, then treat the patient based on that. So it's very challenging to us to know that this is the exact disease in the first time. So we'll have to basically everything ends up with the history what the parents give. And it is very challenging that they don't give the exact history.
Yeah. So that comes from the awareness that parents have, right? It is such an important space because most of them that you probably encounter are new mothers, maybe a second time mother, but many of them come as a first time parent, right? So I don't think most of us know what is scary and what is not scary, what is dangerous, what needs attention at what point in time, when do we have to actually come to a doctor, and when can we actually handle the child on our own. So to pick from that space, for parents to actually understand when is it that they need a medical attention, could you please highlight on a couple of issues that parents come to you with?
Yeah, basically one thing we have to understand, or the public has to understand, the new parents have to understand, is the wrong notion that the children are mini adults.
Okay.
So please remove that from your mind. And the most of them, what they do is, everything what we give medications to the children is based on their weight. So it's basically calculated dose what we give medicine to the children. So definitely don't give any medications on your own to your children at your home, is the first thing I need to tell you. The second thing is, anything, it's like, even if there is a little cough and cold, as parents, I know that every parent will be anxious about their child's health. So nowadays it's very common to have cough and cold, viral infection here and there. What we do tell this is, first time when they come, they'll have this proper medications at home. And whenever the parents come, nowadays most of them Google everything and do everything. Then they come to us. Then they tell that we already have pain medications at home, we already have fever medications at home, cold and cough medications at home. And then usually they come at a later stage when it is not treatable at home.
Okay.
Okay. That is the main thing. What I want to convey, or what I want to tell to the parents, is that if you feel that it is increasing, if you feel the symptoms are increasing, cold and cough is increasing, it's like more than one day, the child is not able to sleep well at home, it's having difficulty in breathing, fever, of course in viral fever will be there for the first 3 days, high grade fevers will be there. So whenever we give medication, most of them will tell, you have given medication in the morning, till evening we have waited, it is not subsided. Arey, at least give some time for the medication to act. So you have to give in viral infections, the fever will be rising, you have to give the medications, like fever medications, at least paracetamol once in 6 hours. So unless you give, that will be there for the next 2 to 3 days, that fever will subside, it will take time to subside. So any specific symptoms which is alarming to you, which you feel that this is not getting better with the medications I am giving the child, please consult then and there to the doctor who is nearby. Okay, some of them I have seen that they come from a long distance to the doctor, whoever they are comfortable with. In some cases, emergency cases, please don't do that. Whoever the doctor is nearby, whoever pediatrician is nearby, please go to them and show.
Okay, that's a big message. All right. So as a pediatrician, I'm sure you encounter two different categories of parents. One that do everything on their own and then come to you. The other, though it is simple, they don't know what to do and then they come for everything to you, right? It comes to a point where you tell them that, okay, if it's like this, why don't you start off and not wait for me until the next morning, right? So can you tell me how you handle both of them? What are certain things that you tell both? We'll probably pick the ones that know it all and then come to you first.
For any doctor, it's a pediatrician or any department of the medical profession, I would say communication is the key. How you communicate to the parents as a pediatrician, how you communicate the illness or the treatment, or you tell them how many like days or the duration of the treatment it is necessary for the child, is to explain. The doctor has to explain it to the parents very nicely. And of course, what you said is true. We get sometimes very irritated by the repeated number of the questions, than the same questions people asking, keep asking again and again. But we know that they are more concerned about their child's health. It is their anxiety which is making them ask those questions again and again. So it's our thing to not get irritated by those questions. And even if they ask 100 times, I would explain them if it's in a very polite manner. So that is one thing, that is the anxiety. The other kind of the parents, what you told is, even if you tell them 100 times, they would not do it. They would do whatever they want and then come again later.
That's dangerous.
That is very dangerous. So I would just say the tablets and other things is one thing. When you just tell them about nutrition and other things, healthy food, to give healthy food at home, whatever the home food you prepare is the most healthiest food. But still, they tell that the children are not having junk food, not eating anything outside. But the first question you ask them, what are they eating? They'll tell you is biscuits and milk in the morning. See, bakery items and biscuits are the main culprit, I'll tell you. They have the highest amount of sugar and maida in them, which will ultimately cause the nutritional failure, growth failure, or they'll mainly cause constipation in children because of the maida and the sugar. So first and foremost thing is avoid the junks and the whatever the bakery items and everything. Reduce as much as possible. Give nutritious food to the child. The health will be much better. Okay. Prevention is cure. Try to prevent anything from happening first.
Okay.
And for children, of course, immunity is not that great. They will be recurrently getting infections, viral infections and other thing. So don't need to get hyper worried about things also at times. There are situations that children will be getting every 15 days, cough, cold and everything will be there. No need to get hyper worried and run to the doctors in the midnight, call them in the midnight and everything. But one more thing is, don't neglect also. Don't neglect also. If you are concerned, please show it to the doctors and take the treatment.
Okay.
Okay.
It's
a double-edged sword.
Understood. I have a couple of questions around this. So, so there are children. Probably it's to do with the age, right?
Yeah.
Probably until they turn 1 year, everything is a risk. It's better we don't assume anything and then give medications and treat on our own, even if the doctor is not probably available at that point in time. So, could you tell us what are those parameters that parents have to note and take care of until the child is a 1-year-old or gets into a toddler phase, and then maybe we can pick the next age range after that. But until like newborn babies, right? What are those parameters that parents have to really take care of?
So what we call them as danger signs. Just before any mother and the baby gets discharged from the hospital, we do tell them to look into these danger signs specifically when they go home. One is not feeding well or insufficient feeding. How do you get to know that whether the baby is feeding well or not? Because we do tell exclusive breastfeeding for the first 6 months of age.
True.
And not to give anything in that. So first and the foremost thing they have to see is the huge practice of prelacteal feeds. To giving either honey or sugar water or anything to the baby should be discouraged. At any cost should be discouraged. Then it comes to a point that exclusive breastfeeding has to be given for 6 months. If the baby is not taking feed well, how do you get to know that baby is not taking feed well? 3 points we have to consider is whether the baby is passing urine or not at least 6 to 8 times per day. Where will the urine come from is only from the milk which you are giving. So if the baby is having sufficient milk, the baby will pass sufficient urine. Then either the baby is sleeping at least for 1 to 2 hours sufficiently after every feed. Okay. After every time you breastfeed, the baby should at least sleep for 1 to 2 hours. It means that baby is getting sufficient feeds. The third thing is baby is gaining adequate weight. So whenever you go for a regular checkups, please check the weight of the baby. If the baby is not gaining adequate weight, then there is a problem. So these three things has to be made sure to know that there is sufficient feeding is going on to the baby. The other danger signs what we tell the mother to see is either baby is getting blue, cyanosis. That means there is no sufficient oxygen which is going. There is some problem, either there is some problem in the baby has some infection, problem with respiration or anything. Because of that, oxygen supply is not good to the body and baby is turning blue. It's an emergency condition. Please get the child to the hospital as soon as possible. The third thing is if the baby is getting excessive fever, vomiting, then that is the situation where there is some gut issues or baby is not. One more thing we do tell where parents get very anxious is about the baby is not passing stools. 3 to 4 days the baby has not passed stools. We do tell them that even if the baby doesn't pass for 1 week also, it's fine.
When you're saying baby, you mean until a year old, right?
Until at least a month to 2 months, I'm telling. If the baby
1
is
or 2 months old baby.
yeah,
Okay.
if the baby is not passing stools for like 7 days, 6 to 7 days, it's fine.
Okay.
Only after 7 days, after a week also baby is not passing, then you consult.
Okay.
Sometimes babies do pass 5 to 6 days once, stools 5 to 6 days once, that is fine. So these are the major things you have to see. If the baby has difficulty in breathing, then there is a lung infection, you will have to come to the doctor emergency. If the baby is turning blue, you will have to come to the doctor emergency. There is excessive vomiting, excessive fever, neonatal fever, baby 1 month, 2 month old child is getting excessive fever, then it is a major concern. Okay, what we tell is sometimes having a dehydration fever also. Dehydration fever is due to the baby is not taking good amount of milk.
Okay.
There is excessive dehydration. Because of that, the sodium level in the body excessively increases, and there in neonatal period, hyperbilirubinemia means jaundice is one of the major concern. If there is insufficient feeding, then the jaundice also increases too much. If it goes to a very high level, then your brain gets affected, baby may get paralyzed or cerebral palsy and other things do happen. So these are major concerns. If your baby is becoming yellow, baby is becoming blue, baby is not passing urine, baby is not gaining weight, and baby has fever or vomiting, these are the major danger signs. You'll have to come to the doctor.
Okay. Post this baby phase, what are the signs that we have to look out for to consult a doctor? I'm not even talking about risk or danger, but whatever needs a medical attention after that phase of being a baby, what are those?
So one we do tell is everybody knows basically that fever medication is paracetamol. So for a day of fever, for many people are anxious, even on the day 1 of fever they get the child to the hospital. I'm not telling it's wrong. So what we tell whenever they come also, what we give them is basically only paracetamol, that is symptomatic treatment for the fever, and tell them please wait at home. Once in 6 hours you give the paracetamol, wait only after 3 to 4 days of, if there is a continuous fever spikes even after 3 days, please come back and get the blood investigations done. So if you have a child who is continuously having fever for more than 3 days, or there is a respiratory problem or cough and cold which is there, which is not subsiding on the medication, it's continuously increasing, or the child is having difficulty in breathing. One more main thing, even a bigger child, little bigger child, they do get up from the sleep, coughing. They have disturbed sleep because of the cough. That is one of the thing you'll have to come to the doctor.
Okay.
Okay.
A general cough while sleeping?
No. Excessive. They can't sleep only.
Okay.
They'll be continuously coughing. They can't sleep. Interrupted sleep because of the cough. So that is one thing you'll have to come.
Okay.
Or if it's a known case of Valerie or wheezing child who had already been on medications before, nebulizations and MDI, you'll have the things called exacerbation of these symptoms whenever a season comes. Whenever the winter season comes, or due to some allergies, if they have exacerbation, so that time they'll have to come to the child to get nebulization, doctor to get the nebulizations and everything done. So sometimes they will be the child will be very sick looking or not able to breathe properly, oxygen levels will be decreased. Those kind of things you will not come to know as just by looking at them. So as a parent, you will have to know those things, like how your child was before and how is the child now. So if you feel the child is sick looking, needs medical attention, as soon as possible you have to get the child. So I am telling you about only the basic things now.
True.
So only the fever, cough and cold. There are other main reasons which they would have known from the beginning, which needs a regular...
Easy to identify also, no?
Yes.
There are other more dangerous signs, right? Okay, so we spoke about issues, like how to identify risk factors, things that you see for anything that's dangerous. What about things that a new mother should know about a child?
First and foremost thing, a new mother should know that they all have the thing that I am not getting milk. The first and the foremost thing they tell that I am not getting enough milk to feed the baby. and they then end up again shifting completely to a formula feed. So formulas are made only when there is insufficient milk to the mother and the mother is not getting milk only, then going to the formula is okay, not directly shifting to the formula feeds. First and foremost thing, a mother should know that should not take stress, and it's completely a feedback mechanism. Unless you put the baby to the breast, there is no milk production. So it's a feedback mechanism. Once the baby sucks only, your brain tells to produce the milk. So they have to know that thing in mind. And first 1 or 2 days, the amount of milk will be less only. Please don't take stress. First 1 or 2 days, you will get 1 or 2 drops only. So from day 3, day 4, your milk production will start improving. Please don't leave feeding just because you are getting 1 or 2 drops. Colostrum is the most important thing you have to feed your child.
Colostrum is the first milk.
So you'll have to feed the child. So feed every once in 2 hours, you're getting milk or not, put the baby to the breast and feed the baby. First and foremost thing a mother should know about is the feeding of the child. Then the other things will be like whatever I told, all the danger signs she should know. And one more thing is, nowadays there are called milk banks. As like blood banks, there are milk banks. Where mothers do donate milk, excess of milk, whatever is there, they do donate, and they can be refrigerated and kept for even 6 months.
This is donating of milk.
Donating of milk. Why I am telling this is, many of the preterm mothers and everybody, they have this issue of not getting milk. So better than formula feeds, what we tell them is go and get the donor milk. It's however a human mother's milk only. So mother's own milk, that is EBM, mother's own milk, what exclusive breast milk you are giving. So the next milk is the donor milk. After that comes your other formula feeds and everything. So if you are not getting milk, you can always go and get milk from the donor milk bank and give it to the child.
Is it safe?
It's completely safe. It's completely safe. It's pasteurized, it's done, everything will be done and kept it. It will be kept there in the milk banks. So nowadays milk banks are getting opened everywhere, in every nook and corner, every districts. So the importance is given because of the same reason that it is the best milk. Mother's milk is the best milk. So they say it is equal to Amrita. No? So if you are not getting, if mother's milk, if you are not getting the milk, then the next best option is that. So that thing is one more thing the mothers have to know. One more thing what they do at home, elders do is exactly like 6 months exclusive breastfeeding we do tell. So they end up starting other things from 5 months of age. Baby has completed 5 months, we'll start from now only. Our children we have started now also, what will happen, we will start now. No, please, as much as possible give only mother's milk till the 6 months of age group. After 6 months is completed, then only start the other things.
When you say other things, what are they?
The thing, and the one more thing I wanted to tell you is, after 6 months everybody starts getting the ready-made thing, Nestle, Cerelac, everything from the medical shops or everything, and starting. No, please don't do that. All of them are not useful as much as you prepare something at home and give. So one thing, you can start with smashed vegetables. You can give rice water. You can give dal, smashed dal you can give, smashed vegetables you can give. And one more thing is, a child, whatever, even an adult, if you introduce something new to them, of course many of them will tell, no, I don't want it. So the thing you have to make sure is that when you introduce new thing to a child, it will not take it at the first moment. You'll have to introduce the same thing at least for 15 days in a different manner. So that the child is accustomed to the taste. Then if it likes or not, it is the second thing. But at least introduce it. Once you give them, they are not taking, everybody keeps telling that no, my child doesn't like this, I don't want to give. They switch to the other things. So we end up giving non-nutritious food to the child than giving the nutritious food which we are being prepared at home. And they do in before 6 months, they end up giving goat milk, cow milk and everything. Giving goat milk causes folic acid deficiency.
Okay.
And giving excess of cow milk causes iron deficiency also. So to not giving these things is the best thing. If you are giving, that may cause the baby will not be able to digest those things first, may cause dehydration, may cause diarrhea, may cause excessive vomiting, may cause some gut infection. If you have not boiled and cooled properly, I told not to give only, first of all. Even if it is there, please avoid them from now on, and make sure you tell others also not to give cow milk or goat milk to the children who are below 6 months of age group.
Okay. So post 6 months it's allowed?
Post 6 months it's allowed. You can, but as much as possible don't dilute the milk.
Okay.
Okay. If you are giving Nandini milk also, give the thick milk only, which have at least the fat content in it, and the babies are getting enough of nutrition from the milk. If you excess dilute the milk and give, it doesn't serve any purpose. It's just like giving water to the baby.
Okay. So cow milk or formula feed?
For
Post 6 months, if required, what is better?
no, post 6 months you can always start with giving cow milks. At 7 months, 8 months, you can always introduce cow milk to the child. It's nothing wrong. Okay. When you tell about formula milk or cow milk, there is no difference, I'll tell you. Because post 6 months, it's just giving an extra nutrition to the baby. When you can always give vegetables and dal and everything, giving these things is like just an extra thing to the baby, that's all.
Okay.
And breastfeeding can be continued till 2 years of age. So if you have enough of milk, please do continue giving breast milk to the child till 2 years.
Okay. What about children who are lactose intolerant? Before 6 months, after, like how do you deal with them?
So basically they don't come up, they may come up soon after the birth, or they may come up after some days after the birth also. So what they do come up with is excessive loose stools, which is happening because the baby is not able to digest the mother's milk. So there is lactose present in the milk, which is causing, they have the deficiency lactase enzyme which is deficient in their body, which is not able to convert the lactose which is present in the milk. So because of that, the child is getting excess of diarrhea, loose stools which are there. So we end up giving them the enzyme from outside to add it in an expressed breast milk and give it to the babies, so that the thing is easily digested. Or the second option is to completely stop the breast milk feeding and switch to the formula feeds or the other feeds.
So children who are lactose intolerant are not intolerant to formula feed?
They it's like there are formulas which are specific formulas which can be given to the lactose intolerance children. The less lactose having formulas.
What are some of the alternatives then?
See, one of the thing is the soy milk which they give, that is there, but usually I have not seen doctors prescribing soy milk regularly to a children who is lactose intolerance. So that maybe after 6 months of age group you can introduce those things, but best thing is to consult a doctor and then to go about it how to give the milk.
Sorry. Okay. As a new mother, how do I actually identify that my child is lactose intolerant?
That's how the thing I told is, they will be having excess of loose stools.
Is that the only thing?
Excess of vomiting can be there, loose stools can be there, growth failure can be there. The child is not gaining weight even after drinking the milk.
So generally a doctor identifies this, or can the mother actually identify something like this is happening? Because weight check is something we do only in the hospital.
Yes.
So how does that work?
See, the thing is, the baby will not be, even if the baby is taking, it will be throwing out the milk, or everything will be getting lost in the loose stools. So you will come to know that baby is not gaining weight. One thing that can be easily noticed, not specifically by the doctor when you go for a visit. That can be easily noticed by a mother. On all these symptoms can be easily noticed by the mother. So the main things is only these things like loose stools, vomiting, and growth failure. If these things are noticed and then taken care of, then it can be easily found out that whether the child is lactose intolerant or not. It can be due to many other causes also.
Sure. Okay. So, a couple of questions around pediatrics itself. Typically, what is the age range that a pediatric doctor handles of a child? Like it's from newborn to
18 years.
18 years.
So, in many places they do handle only till 14 years. Few places they do manage till 18 years.
Okay.
So, whenever I did my PG, we used to handle there, wherever the medical college I have learned, they used to handle only till 14 years. But then after coming to other hospitals, I have seen them handling till 18 years. So, as a pediatric, you can tell till 18 years.
So, what is this 14 then? I mean, why 14?
No, it's based on their, the hospital policies.
Oh, okay. It's nothing to do with teenage, adolescents or anything like that?
Nothing like that.
Okay.
So, it's just a matter of understanding between the medicine and the pediatric department.
Okay.
From there, they will take, from here
it's
we will take.
It's more of a medical call.
Yeah.
Okay.
So, the main thing why, because they have chosen 14 years is mainly the adolescents is they would have gained weight till then. Whatever the medications you give is almost the adult dose.
Okay, okay. So, you shift to the
adult dose. So, here they do till 18 years is fine. We give them the adult dose only, but we know what to give, that's all.
Okay. When can children start tablets? What is the age?
This is one main thing I wanted to tell. Make sure the thing is there in children's medications there are drops. From beginning I am telling there are drops, there are syrups, suspensions, and then comes tablets, capsules, and everything. And then whenever I told you that we are giving medications based on the weight of the child, drops and syrups mainly. The drops and syrups, drops will always have a higher concentration per ml.
Correct.
Syrups will have a lesser concentration when compared. Okay. When we tell in just taking an example of paracetamol, I am telling, we'll get 100 mg per ml in one Calpol drops or one paracetamol drops, we get 100 mg in 1 ml. Okay. When we come to syrups, we get 120 mg in 5 ml or 250 mg in 5 ml. So, per ml, what we give differs. Okay. Whenever parents, whenever they directly go to a pharmacist and ask, or sometimes it gets missed in pharmacy thing also, we write drops and give, they give syrup. Or we write syrup and give, they give drops. So, sometimes very less, but I have seen it happening that it gets interchanged and they end up giving more drug or medicine to the child. And then later, whenever the child is adequate amount of weight and all, we shift them to tablets. And most of them, even the children, they will be like, nah, we will not take tablets, we will take syrups only. So, based on their convenience, how they take the medicine, we end up giving sometimes 10 ml of syrup, 12 ml of syrup. Is just the baby should take the medicine, that is the main thing. So, whenever the child is more than like 4 years, 5 years, we end up shifting them to tablets. Because that is the amount of medication they will require for their weight. And that is available only in tablet medication. Easily can be taken in one tablet, this much of amount of medicine is going in. Or syrup you will have to give for 12 ml, 15 ml of syrup. That is better to take a tablet than to take so much of syrup.
Okay, okay.
So, it's just the medication, the pharmacy thing is like same as like adults, the tablets and everything, capsules, everything is same. Just it is depending upon the dosage. You get as I am telling paracetamol, you get a 300 mg thing, you get a 500 mg and you get a 650 mg. So, so all these things have been made for the children to easily take. So, correct dosage can be easily taken. Sometimes if you, our calculation comes to 280. or 290, it's okay to give 10 mg extra. So if you give 300 mg ka tablet, it is fine.
But it's still preferable that you get your dosage from prescribed from the doctor,
yes,
right?
Yes.
Okay. What is your take on vaccinations?
Vaccinations, okay. The thing is, everybody, we know that regular vaccination should be done to the babies, but still there are people who are hesitant to give vaccine.
Yes.
The thing of vaccine hesitancy has only come. That's a terminology termed vaccine hesitancy. So I'll tell you, vaccines are the most thing you have to give to the child for the prevention of the diseases. I'll tell you, parents do come and ask, even after giving this vaccine my child is getting. I can't give you 100% of the guarantee that after giving this vaccine your child will not get cough and cold once also in your life. No, those vaccines are developed based on certain strains and to prevent the further complications which may happen because of those diseases. So it's well and good to take some protection against the diseases.
Right.
So all vaccines are important to be given to the children so that we'll end up preventing the complications of those diseases. And some of the diseases are like is like flu vaccine, influenza vaccine. We recommend it to be taken every year, annual influenza vaccine, because there will be a season where you get too much of cold and cough, repeated episodes will be there. So if you take a flu vaccine, we do tell that there are chances of getting cold and cough regular will be less. Or you getting a viral pneumonia or many serious infection because of influenza is reduced if you take the vaccine.
It's not 100% nothing going to happen to you case, right?
Yes.
But you still recommend that all the prescribed vaccines are taken for children?
Yes, we do prescribe. So there are few vaccines which are endemic vaccines. They give only for the places where some diseases are endemic. So JE vaccine, if you tell Japanese encephalitis vaccine, it is recommended only in few districts of Karnataka.
Oh, okay.
Okay. No, it is not given everywhere. It is given at 9 months, 2 doses are given, but given only in few districts of Karnataka. So few vaccines are there. If you come to Bangalore, they'll tell it is not required as such. JE vaccine is not required. Japanese encephalitis is not much. If you go to Kolar, if you go to Chitradurga, Ballari, and Davangere, they do tell you take the JE vaccine. So few vaccines are endemic to those places. So better wherever you are staying to take whatever is prescribed.
Okay.
To prevent the complications. So we have something called as National Immunization Schedule and the Indian Academy of Pediatrics schedule. So National Immunization Schedule is whatever you get the government vaccines. So all will be there. So they have this thing that if we take private vaccine, whether we'll get more advantage, or if we get from the government, is it like cheap? They are getting less potent vaccines, are they giving? Nothing like that. Okay, if you are comfortable in taking National Immunization Schedule, please take that. But in IAP there are few other optional vaccines, what we call them. Okay, it is left to you to take.
Okay.
But as a pediatrician, I would tell you take everything. Okay, but most of the people do end up taking only like in a rural places, or if you have come from rural background or anything. What I have seen in PHCs and everything, they do follow in government hospitals. What they follow is the National Immunization Schedule. They give whatever vaccines is there in that. Okay, and there are few vaccines, meningococcal vaccines and everything. Only if you are traveling to Arab countries, it is must and should that you have to take a meningococcal vaccine. Okay, because those diseases are more prevalent there. You should not be going there, catching up a disease and coming back. So it's must and should for a children or an adult to take that vaccine and go.
Okay.
So, and other vaccines like post-exposure vaccines, mainly rabies and other things are post-exposure vaccines. We do have to take them when it is necessary.
Okay. Why are parents actually hesitant for vaccines? Like, what is the reason for it?
One is the cultural background. Most of them I have seen is religious things. What I have heard is that our religion doesn't allow to take this vaccine. This is made up of like cow background, it has come, or it has been derived from the pig, it has derived from an animal. So most of the vaccines we do test on animal, then only it is then derived. And more vaccines, even antigens, are everything developed. Some of them are developed from chick embryo vaccine. So human, this equine widow, that is horse, these rabies vaccines are everything. There is equine vaccines are there. So things are like they have been developed from the animal, this thing. So few, because of the religious things, they are hesitant to take those vaccines because of those ideologies, whatever they have.
Okay.
So most of them nowadays, it's very less. That vaccine hesitancy has come down almost to 1% or like less than 1%, but still it is there.
In India, is it actually, do people hesitate for vaccines in India?
Mostly no, because
it's more of a Western influence,
Yes,
right? Where it has
yes.
come, where people say no to vaccines, and there are a couple of them who say that I've not vaccinated my child for anything.
in India, if I have to tell you, this vaccine hesitancy is not the thing. Here, the main thing is the child is vaccine delay happens more. Vaccination delay happens more. Child is getting cough and cold. Let it settle first. We will go later and
Correct.
take.
Yeah.
So most of the things what I've seen is vaccination getting missed at that time, where it has to be given. But always there is a buffer period.
What is that buffer period?
It is different for different vaccines.
Okay. So it's best to go as soon as
Yes.
it is actually scheduled. If you cannot, the earliest you can go is better, you're saying.
So the thing they do call, parents do call.
Yeah, I mean, I'm sure all of us would go through that.
Yeah,
right?
yeah. They do call that we have missed vaccine last week. It was there. We have missed. Can we come now? Please do come. Okay. If it is missed, no problem. Nearest whenever you can, whenever the child is healthy, go get vaccination done. Okay. Don't get it missed just because the child had some diseases, or you are traveling somewhere. Because of that you can't go get it done. Most of the things this vaccine is happening just because either the child is not well, or you are traveling somewhere, or the parents are busy not to get the child vaccine.
True. Okay.
So that is the main thing which I am seeing in India. Then this vaccine hesitancy is Western concept, as you told.
Yes.
Most of it is like that. But in India this is happening. One more thing is education about the vaccines. Now of course Government of India and everybody has taken steps to tell people that vaccination is important. But still there are many places, rural places, you have to educate them that vaccination is important. Please go and get your child vaccinated. So
how about the availability of vaccines and affordability of vaccines across the rural areas in India? Is it affordable?
See, that's what I told. All the government vaccines
Correct.
are free.
Okay.
So you don't need to pay anything for that. Any PHCs or CHCs, the rural health hospitals, whichever is available, all hospitals do have vaccinations and they are free of cost.
So it comes down to awareness.
Yes, it's come down totally to awareness that we have to take steps to make the people aware that vaccinations are important. Please go and take them.
Okay.
There are, of course, as I told, these optional vaccines, few are very costly. Few do hesitant to take. Some pneumococcal vaccine, as I told, is given to prevent recurrent pneumonia happening to the child because of the pneumonia bacteria, pneumococcus bacteria. Also, pneumococcal vaccine is given for that. That usually costs around 3,600, 4,000 rupees. So people are hesitant. Should we give this? Like 3 doses are there, or 12,000, 10,000 gets wasted. I'll tell you, if your child is getting repeated episodes of infection, it is better to take.
Correct. Yeah.
Better to invest once than to invest more times going to the doctor and giving extra money. Better to invest once in the vaccine and be safe.
True. Okay. As a doctor who's handling children, right, do you feel that there is a rise in developmental delays nowadays?
Yes.
And why so?
It is a multifactorial thing.
Okay.
I can't just tell this is the main reason. The one thing is the stress which the parents are having. So work stress, it may be work stress, family stress and everything. That is one thing which is reflecting onto the children. The other thing is maybe due to the child neglect is one more thing happening. Both the parents are working, nobody is there to look after the child. They get isolated. The psychological problems are coming because of that.
Okay.
There's nobody to look after the child, nobody to give attention to the child. So they have that alone thing is there. They get isolated. So more of psychological issues do come to the children because of that. Okay. There are other things about the family quarrel they see or divorce which is happening more. They get separated, raised by a single child. All the things are like indirectly impacting to the growth of the child.
Okay.
Okay. As you told about the developmental delays, we tell birth asphyxia is less than 10%.
Okay.
Okay. The child is not cried at birth, the oxygen has not gone to the brain and has caused the developmental delay. The what we call as global developmental delay means the delay in all the domains. Like there is motor delay, speech delay and everything. That is less than 10%.
Okay.
Okay. The other 90% is completely multifactorial. It is like various other factors are there which is contributing to the
This one.
delay of the child. So other 2 to 3% may be because of some congenital infections. Now there is a rise on genetic disorders. The coming thing is there is a more rise in genetic disorders. The genetic, or maybe I can tell, we are more in technology that we are finding them out.
Right.
Okay. Maybe it was there before, not noticed, but here now the technology has developed so that we are finding out more of the genetic diseases which are there. So we do normally what we call this universal screening when the child is born. Okay. Nowadays most of the hospitals are getting it done. The universal screening is there to at least to look after the things which are getting missed. Normally some of them they do for 11 diseases or 21 diseases. As soon as the child is born, they do send the blood and get to know that whether there are some genetic diseases which are there. Then getting to know after the child becomes sick. So it's a universal screening which is going on, which is helping us to know that these genetic disorders are there, which may ultimately again cause your genetic global developmental delay.
Okay.
So I can't pinpoint that this is the cause for the rising of the diseases or the developmental delay in children. It's completely multifactorial.
Okay. Is it okay to force feed a child?
Definitely not.
So how do you handle if a child keeps rejecting food?
That's what. The thing is, if the child is completely rejecting whatever is it, try to introduce the same food in a different manner. Okay. If you are like, see, if you are trying to feed a rice, okay, child is not taking the rice with the milk. It will rice and milk. You try to introduce, the child is not taking rice and milk separately. Try to add ghee to it. Try to add jaggery to it. Try to add sugar to it. Try to make it more interesting.
This is for a child after a year, right? Because you can't give sugar and all that before.
Yes.
What about when they start on solid food? Like there are a lot of children who are not, or rather when we see, we feel they're not healthy, right? So, a lot of mothers, they believe that you force the child, feed the child so that the child is fed and is fine. It's a thought that runs in the mother. If the stomach is full, the child is fine. So, however it is, I will feed the child. If that is not right to force feed a child, then what is it that a mother can do?
See, I will tell you, run around the child and make the child eat, that is completely fine.
Right.
Okay. The child will not sit at one place and eat.
Right.
That kind of force feeding, I agree, it is to be done. The thing what I am telling you is not overfeeding the child. Okay. That is one thing. Force feeding is like you try to introduce, you try to feed them again and again. They are spitting it at that time. Okay. Give little time. Whenever the child is hungry, child will eat. Okay. I have seen my own mother doing it to my nephew. Feeding, she keeps feeding, she gives apple now. After 1 hour she gives milk. After 1 hour she gives orange or something. Then after 1 hour, no, give little time, let the at least
Food
get it digest. So that is force feeding, I am telling. So that is overfeeding, that is forced feeding. No, don't do that. Whenever the child is hungry, the child will take. There at least, see, as adults we take 2 to 3 meals at least per day. Okay, fine. You give the child once in 3 hours. Okay, or once in 2 hours. Once in 2 hours very less. It's as the child grows, it will not take once in 2 hours.
Yes.
Okay, give it once in 3 hours, once in 4 hours, or whenever the child is hungry, he or she will come and ask. Okay, that force feeding is not to be done.
Thank you so much for that wonderful conversation, Doctor. It's created, I'm sure there is a lot of information that you've provided, and I hope it helps a lot of people. Thank you for your time once again.